Mr. Chairman, ladies and gentlemen, thank you very much for your kind invite to this prestigious conference to talk about the role of artificial intelligence in surgical training. I present my proposal of AESOP to your prestigious conference and all the audience. When I received an invite to talk about artificial intelligence and its role in surgical education, this took my mind in several directions. First and foremost, I must iterate here that artificial intelligence is important, it's here to stay, and it'll become the mind of or the brain in future. As far as the natural intelligence is concerned, it will become the heart because of its several attributes. Of course, as humans, we have the traditional wisdom, the spirituality, intuition, and many good and bad traits, but overall reflection and other aspects which will always keep the natural intelligence over and above the artificial intelligence. When we talk about integration of the artificial intelligence in surgery, you have to ask why, when, what, and how. It's easy to answer the first two, why and when, whereas what and how, we are going to talk more in depth about this. Now, while thinking about preparing this talk for you, it took me back nearly a quarter of a century. The setup was 1998, an afternoon in an operating theater where I, as an associate specialist, was more or less an observer. And I'm telling you the story about that, the fable. There were a few laparoscopic fellows inside theater. There was an AESOP, the title of my talk today as well, and a professor of surgery. So let's start from the professor of surgery. He was Professor Michael Bailey, an eminent surgeon working in the Royal Surrey County Hospital in Surrey in England. Professor Michael Bailey has been the prodigy of great Norman Tanner, and we all know his name from his various innovations. And he has been a great surgeon and a leading surgeon in laparoscopic surgery, director of Minimal Access Training Therapy Unit, my teacher and trainer, and especially my teacher and trainer in the field of teaching and training of laparoscopic surgery on a global level. AESOP. You must be wondering what was AESOP, and this is AESOP. Professor was yelling at it, asking it to turn right, turn left. It wasn't moving, and one of the laparoscopic fellows commented that professor was yelling on it as if this was his pet dog. This was artificial intelligence. My first exposure to artificial intelligence. Not perfect, but at the same time, predecessor to the Da Vinci, which arrived about 4 or 5 years back in the United Kingdom. So I've been a keen learner on artificial intelligence and the use of the robotic surgery or the robotic assisted surgery in surgery since. AESOP, as we all know, is a great philosopher, great thinker, diplomat, and a storyteller from 650 BC, nearly 2.5 millennium back. If we say that the name of the first artificially intelligent camera holder was named after him, the acronyms, and this was supposed to be ethical and true to master's command. And now, 2024, we are talking in Shalimar Hospital, and we are talking about the application of surgical training in the era of artificial intelligence. We want our doctors to be learned, ethical, and true to a master's command in the era of artificial intelligence, and it's ever so important now than ever before. When we talk about AESOP, we are very familiar with his many fables that he introduced us to. And as young ones, we learned and heard these fables from our parents, teachers, the hare and the turtle, thirsty crow, greedy monkey, wolf and a lamb, and many more that we have heard over the years. And there is something special about these fables. All these are stories which are thought provoking. These are morally, ethically, socially, and religiously correct messages going to the young ones. And there is a take home message, a moral, as we call it, a moral for life for an ethical and upright individual. And that's very important for us as a community of doctors and surgeons to produce individuals who will take this beacon forward. When we look at any surgeon's journey, As a child, we learn the fables and the ethics from various sources when we are young, and then as medical students, we learn the sciences and things, and then right towards the end of it, it's complemented by a Hippocrates oath, which just gives us an idea of how we should conduct ourselves. And then, of course, our lives are ruled and governed by our medical specific laws like PMDC, GMC, DHA, and various other organizing bodies in various countries. And as an individual, we also come across some general laws in our life as well. Let's say I take an example of the driving. We do the theory practice test. It is a tough one. Then we go through the practical classes and then we learn how to drive. And we are deeply informed about the rules of engagement with the fellow road users and the benefactors as well as the beneficiaries of the roads who are using that route. I must admit that the civil morality and legal responsibilities are better learned, taught, understood, and practiced as a driver, possibly than as a doctor. And that is my issue that I'm going to talk about when we will talk about the introduction of the artificial intelligence in surgical practice and teaching our young doctors with this. When we look at the pyramid of the medical schools, the base is missing. We learn the facts and science, apprenticeships, surgeon, and then the big M. We talk about the doctors and the surgeons as messiahs, the surgeons are leaders who can do some wonderful things and heal the fellow human beings and help the humanity. But without us going through the fables, and that is missing in our curriculum right now, and that's what I'm going to focus about. And especially will become very important in the era of artificial intelligence, because without this strong foundation, there is a worry that we'll get lost somewhere. When we talk about the artificial intelligence tools for surgical teaching and training, there are many specific tools that can be used: ChatGPT, voice recognition, simulation, various other things to help us not only learn but also to practice and to improve our skills and then to continually providing excellent services to our patients. When we talk about these roles of various tools, these are all available in general and in specific that we can use in our practice to become better doctors and serve our patients in a better way. Now, when we talk about the surgical education in AI era, I believe, and this is my proposal and my thought process, that it should have the four components. The components will be knowledge, skills, ethics, and reflection. And without those four pillars and any one pillar missing, I think this building will be very weak and the foundation of our doctors will be weak. I'll just go through these one by one. What is my own perception about these four pillars for surgical education in AI era? If we look at the knowledge, it should be broad-based, but at the same time, it should be focused, disease-specific. It should be matrixed and linked very well to the associated fields and specialities, but it should be futuristic and up-to-date, AI and others. So our curriculum needs to remain more or less the same, but needs to be enhanced with artificial intelligence and various other new technologies which are coming into existence. The learning will become very easy. We will be able to conceptualize it, try it, practice it, and then implement this in our practices. When we talk about the skills, the things are going to get much better in the skills section as well. Like in bodybuilding, there are three types of exercises: the builders, the shapers, and the finishers. So the same thing will go in the skills as they already do in the surgical practice. And then, of course, the showtime package, those people who would like to become teachers and trainers and would like to demonstrate this to others, they will have to have some further ability over and above of what they already have. When we talk about the ethics, the artificial intelligence compliant ethics need defining, and I believe that there should be four components in this as well. Everything is in fours, easy to remember. It should be contemporary, it should be for oneself, it should be for the gallery, and it should be for the God, our creator. And I divide this that for the contemporary ethics or the ethical practice of AI intelligence incorporation, these apply as these are in the region or in the country. For oneself, these will be more or less based on one's upbringing and based on one's understanding and instincts about morality and responsibility. But for the gallery, it's very important for us to have very strong ethical bases and foundations for the regulatory bodies, for the societies and for the media as well, because we expose ourselves to media to introduce ourselves, but at the same time, the media has an eye on us as well. So I think that's very important. And for God, it's very important for us to remember, if the patient and the family are not seeing us at any one point or time when we are taking care of the patient, let's say in theater, the God is. The next thing is the reflection. So I would say that reflection is important for all the surgeons and doctors and fellow human beings, but it'll become even more important in the era of artificial intelligence. Again, the reflection we should categorize into four categories: for the regulator, for peers, for oneself, and for God. And for reflection for the regulator, just follow the rules. Whatever you're advised, just follow it. For the peers, it'll become even more important to follow the team approach and to be sympathetic with each other. We should be very happy to give advice to each other and should remain open to accept advice from our colleagues and friends and to stay corrected and remain corrected. For oneself, we should be extremely self-critical in the era of artificial intelligence, in private and in public. We are currently as well, but this will become even more important. Then talking about a reflection for the God, and I think that is the most important. That's what brings us more to be a human and a subservient to our fellow human beings. We should be grateful for what we have, our skills, our intelligence, and the artificial intelligence. We should be apologetic and we should be self-reflecting and critical on our mistakes and errors. But we should seek help and light and guidance from our Creator just to be able to serve our fellow human beings better. When to follow AESOP? I think from the time of birth until we go to our grave. So this should be taught in schools and nurseries. Medical students should definitely be taught this, junior doctors, young doctors, and experts in surgery. Its role will change and emphasis will change, and there should be a different curriculum at every level. Who needs AESOP? The society in general definitely needs it. The doctors' bodies need it. Medical schools, colleges, and universities must have it. That's important for them. And then the patients in particular, they should be more familiar with the AESOP concept as well. The scope of AESOP in AI era. Now, when I was talking about enhance, which is the E of the AESOP, what I mean by enhance is ethical and reflective education of AI in schools and in the medical schools. It should be introduced in all the exams, like driving test. One should be able to answer all the questions right to proceed and go through these. And then, of course, the AESOP continuing medical education at postgraduate level, that's crucial as well. The implementation of EI for doctors, education, education, education at every level. Regulation, that's important for early detection and penalization of the offenders, penalties and rehabilitation. And there should be, I strongly recommend that there should be an AESOP AI committee separate from the quality control in every hospital and medical school. In summary, there are four take-home messages, Mr. Chairman and ladies and gentlemen. The first message is, like the old saying of see one, do one, teach one. I think in artificial intelligence, we should take it backwards. Teach one, do one, and see one. Become consciously aware of this artificial intelligence and keep abreast with it. Do no harm. Do not lie. Be self-critical and be content with your skills, ratings-wise, and financially. Don't compete with each other and outdo each other with the help of the artificial intelligence. Rather work together. Remember that you are only human. Only human. Artificial intelligence is here to help you as a doctor and a surgeon. Please maintain humility even when you're using artificial intelligence. Do not forget that a surgeon is a mechanic of God-made machine. It's a great privilege. Artificial intelligence is here to assist your natural intelligence, and it'll prepare you very well with your diagnostics, with your differential diagnosis, with the fast and efficient results and outcomes of your tests, and it will also help you with your ergonomics and your training to perform better surgery. And implement the 4 pillars of surgical education in AI era with AESOP: knowledge, skills, ethics, and reflection. Knowledge and skills, we can all have it. Ethics and reflection is missing currently and needs to be introduced in a holistic way so that it should complement the knowledge and skills to make better doctors for future. I am grateful to all of you for providing me with this opportunity and giving me this time to listen to me. I present my proposal as a special gift to Professor Hamad Rana, Professor Talat Wasim, Shalimar Medical University, and the beautiful city of Lahore, and to all the audience and the faculty of this symposium. If there are any questions, I'll be happy to take it. Thank you very much.